but the experts told me that wish you okay, as long as you do. But I wanted to just, again, emphasize some key considerations for applying. So the first box in here, you see eligibility. We can only provide funds within LaPorte County. Remember that. I know that several organizations provide services for several counties, but our mandate, if you want to call, how we received approval from the RIS is to be focused on the geographic area of LaPorte County. As much as possible, of course, we're looking to make impact on our strategic priorities or respond to an identified community need. We're open to take a little risk here and there to be able to see how does this work. Remember that we take a very good look at evidence-based practices. So when you go to that site on 10/20/30 and you're looking for best practices, it could be a best practice, it could be an evidence-based. So each program that you open, it will tell you what level of stamp of approval that particular program has. And measurable results, collaborations, address needs for the city of LaPorte. We talked about why this is kind of a priority for us. Not kind, I should say a priority. The budget and request amount, I wanted to bring to your attention that there is nothing as fun to watch as the grant committee saying, wow, this is a match. They went through the effort of seeking, pick one, federal support, state support, different organizations or fundraising to be able to create this, be whatever program, be remodeling a building or whatever it is that's done. So you're coming to us to be a partner on something. It's really, very exciting to see that piece in there. And not to say that we don't fund certain things in full, but it is always, especially large projects, that others are contributing, and you did your homework to not just come to HFL. You have been looking around to see what else is available. One item that's very important is the RIS and public support test. And eventually the next symposium or sometime we really need to show you on the 990 where that area is. But basically the lay way of expressing this is assume that organization A has a budget of $30,000. Let's pick that number. And they're coming to us to ask us for a $25,000 grant. As a private foundation, we're not allowed to give up certain amounts. It has to be based on this public support test. So when the foundation says no, HFL is saying, I'm sorry, we cannot support you on that endeavor, or we can support you at $5,000. It's because we have to look at that. The consequence of that is kind of a funny way to describe, but it tips that organization over. That's just a lay way of saying. And it becomes kind of like foundation owns that organization now, for a better lack of description here. The terminology is much better than that, but just accept my lay terms. So we have to watch that particular item. So it's not saying no because we do not want to fund or for whatever reason. We have to take a lot of different things into consideration, okay? And then the grant cycle selection, please make sure we see that often. Program is going to start in, let's say, October. That program is in October. You miss the first cycle, and you apply for the second one. That opens in May. But you don't have that response until we have the opportunity to go through the process, the due diligence, present. The grant committee, of course, approves, goes on to the board of directors, and we cannot communicate until October 30th, November 1. So make sure you're checking, when am I going to do this, and plan, do I fit on grant cycle 1 or 2, based on when you hear that you have the money. Otherwise, you're all set to go. It's October. Well, Foundation HFL hasn't responded to us. We haven't because of our timeline. We have to give time to go through the process. Remember, we need to, grant committee goes deep into due diligence, then we go on to the board of directors for final approval. Questions about this? Thank you, Jessica. This was very detailed. And the majority of this will be online and lots of tutorials, but you're always, always welcome to email and call. And this is just a little demonstration of all your responses with appreciation. We're going to go into more detail. It's impossible to read. So, Aaron, Amber's house, impacting children. There's lots of very interesting ones in here. I had a chance to just glance through. But thank you so much for taking the time and trouble, because now we can stack and create our own. Can you remember how to pronounce? Good for you. Yes, good job, yes. We learned something new today, huh? Healthy living markers. Healthy living markers again. Healthy minds markers. Lots of very incredible stuff, from like this one, healthy babies, healthy living, healthy minds, things that that particular organization fit in. AD, CPR trained. I mean, we will be taking the time and trouble to digest all of this and share with you so you can see how incredible, the work, the dedication of each one of those organizations, schools, government entities, to make this community a healthier community. So I'm going to stop and just any questions and answers from anyone? Not answers, questions. I'll find the answers from our team members. Key question time.
One of the biggest questions that I struggle with on our grants is when it asks how many people from LaPorte you're going to affect and how many people from...
That's a good question.
Because, I mean, we offer it to everybody, right? If
Yes.
we put it in a playground, but we have
Yes.
300 and some thousand people that come into these parks, and so I never know what number to put there.
Yes. For you, it'd be a complex one as a county park, because you're not going to be at the front door saying, what is your zip code? Where is your zip code? And that kind of stuff.
We have counters that you
I know you do.
but
But it does not separate it. For that case, I would just put in your example, put it in the county, and then somewhere find a way to communicate to us. It's, I cannot segregate City of LaPorte, period, and explain why we accept that. We're not.
you always have.
Yes, yes. And the reason we do this, we want to see the impact on the City of LaPorte on your programs. So a lot of you can do that. It's easy to, but not everybody, and we understand. So don't take every question as, well, how am I going to create this process? Example, very good example. Any questions from anybody? Was this helpful? Go ahead.
Did you simplify the lower amount grants so that I don't call as often?
We did. We did it because of you. No, I'm teasing. We simplified and we fully understand, especially as in your case, as an example. They're all volunteers. You don't even have staff. And there is an opportunity to be able to support something without making you go through what you did the last time.
Well, you guys were fantastic in assisting.
Oh,
Otherwise, I would have.
yes. Yes, we have thank you. We do have an incredible team, and we're here to help. We want to make sure we cannot write the application for you, but no, we can't. But we can, we can assist and, be available to answer whatever question and whatever guidance it's needed. So you guys understand, the primary person for grants is our senior program officer, Jessica. Of course, I answer the same because we work very closely together. Mary is special project, so she is the ones conveying the group. She does not go into the arena of grants. So keep that in mind. We try to keep, state and church separately. It's purposely, she's very busy. She's only here 3 days. And she is the one that pushes our projects, convening people. And that's the arena that she works within. Of course, Elizabeth is our office manager and coordinates all the efforts of the board of directors, and very good at making sure that you go there, you go here, stop, okay? And I follow her directions. Lisa is the primary person for booking anything here, but Elizabeth can help too. And she does a fantastic job making sure that all of you are being attended. And Erica is the coordinator of our communications. And also, she helps manages the education efforts She's working with me to get more of that area taken care of at education. But so each one of us has a primary function, as you can imagine, but we work as a team. So for anything that we do, there will be all you saw today, all of us doing a piece of whatever it takes to make sure we attending needs here. Any other questions? No questions. I know that you guys are anxious to go. So here, let's do this. We can bypass this. The purpose of this little discussion time is for you to please pick up your stone, write something that you want to take away with you, and have an opportunity as you're doing this to chat within your group to see. Notice that we tried, it didn't fit perfectly. Let's use healthy children. Put anyone that's doing something related to healthy children in one table. Well, we took several tables, as you can see. Or, we try to make sure that if you're the same organization, you're not sitting together, so you had an opportunity to meet other organizations. So this was a unique approach. So basically, we're going to combine those two steps, group discussion, and then we're also going to get your little stone, write your takeaway. You could make a heart if you want to, or nothing. But take a stone home to remember, our organization, each one of you, has a great, each one of you took a stone to be able to create this. How does it say? Good for you. I am so impressed that you guys retained that. Okay, is that okay? How about if we do this for 5 minutes and we go on to closing? Talk to each other, write on your stones, there's markers. Get a takeaway and take it back with you to be able to reflect what we just said.